Question 46. Nurse Hazel teaches the client with angina about common expected side effects of nitroglycerin including A. High blood pressure, B. Stomach cramps, C. Headache, D. Shortness of breath. Correct answer, C. Headache. Question 46. Explanation. Because of its widespread vasodilating effects, nitroglycerin often produces side effects such as headache, hypotension, and dizziness. Headaches can be severe, throbbing, and persistent and may occur immediately after use. Vasodilation and venous pooling can increase the amount of blood in the cranial space, resulting in increased intracranial pressures. This can cause persistent, throbbing headaches, along with confusion, fever, vertigo, nausea, vomiting, and visual disturbances. Question 47. The following are lipid abnormalities. Which of the following is a risk factor for the development of atherosclerosis and PVD? A. High levels of low-density lipid, LDL, cholesterol. B. High levels of high-density lipid, HDL, cholesterol. C. Low concentration triglycerides. D. Low levels of LDL cholesterol. Correct answer, A. High levels of low-density lipid, LDL, cholesterol. Question 47. Explanation. An increase in LDL cholesterol concentration has been documented as a risk factor for the development of atherosclerosis. LDL cholesterol is not broken down into the liver but is deposited into the wall of the blood vessels. As the LDL particles leave the blood and enter the arterial intima, they accumulate by being trapped by proteoglycans and are modified. While the modifications of LDL are not elucidated, oxidative modification generating oxidized LDL appears to be an attractive candidate. Question 48. Which of the following represents a significant risk immediately after surgery for repair of aortic aneurysm? A. Potential wound infection. B. Potential ineffective coping. C. Potential electrolyte imbalance. D. Potential alteration in renal perfusion. Correct answer, D. Potential alteration in renal perfusion. Question 48. Explanation. There is a potential alteration in renal perfusion manifested by decreased urine output. The altered renal perfusion may be related to renal artery embolism, prolonged hypotension, or prolonged aortic cross-clamping during the surgery. Intervention or surgical treatment risks versus benefits of repair in patients at increased risk for open surgery should be considered, and no intervention may be appropriate in some cases. Patients should be well informed regarding their options, risks of repair, and potential postoperative complications. Question 49. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? A. Dairy products. B. Vegetables. C. Grains. D. Broccoli. Correct answer, A. Dairy products. Question 49. Explanation. Good sources of vitamin B12 are dairy products and meats. Among animal products, those from ruminants are particularly rich in vitamin B12, which is naturally synthesized by the ruminal microflora and transferred to milk. Dairy products retain, in general, a major part of the vitamin B12 naturally present in milk. Some processing conditions may even add to the basal level by production of vitamin B12 from propionic bacteria in Swiss-type cheeses. Question 50. Karen has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following physiologic functions? A. Bowel function. B. Peripheral sensation. C. Bleeding tendencies. D. Intake and output. Correct answer, C. Bleeding tendencies. Question 50. Explanation. Aplastic anemia decreases the bone marrow production of RBCs, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. Aplastic anemia refers to the syndrome of chronic primary hematopoietic failure from injury leading to diminished or absent hematopoietic precursors in the bone marrow and attendant pancytopenia. Question 51. Lydia is scheduled for elective splenectomy. Before the client goes to surgery, the nurse in charge final assessment would be A. Sign consent. B. Vital signs. C. Name band. D. Empty bladder. Correct answer, B. Vital signs. Question 51. Explanation. An elective procedure is scheduled in advance so that all preparations can be completed ahead of time. The vital signs are the final check that must be completed before the client leaves the room so that continuity of care and assessment is provided for. Question 52. What is the peak age range for acquiring acute lymphocytic leukemia, ALL? A. 4 to 12 years. B. 20 to 30 years. C. 40 to 50 years. D. 60 to 70 years. Correct answer, A. 4 to 12 years. Question 52 Explanation. The peak incidence of acute lymphocytic leukemia, ALL, is 4 years of age. It is uncommon after 15 years of age. It is diagnosed in about 4,000 people in the United States each year, with the majority being under the age of 18. It is the most common malignancy of childhood. The peak age of diagnosis is between 2 and 10 years of age. Question 53. Marie with acute lymphocytic leukemia suffers from nausea and headache. These clinical manifestations may indicate all of the following except A. Effects of radiation, B. Chemotherapy side effects, C. Meningeal irritation, D. Gastric distension. Correct answer, D. Gastric distension. Question 53 Explanation. Acute lymphocytic leukemia, ALL, does not cause gastric distension. It does invade the central nervous system, and clients experience headaches and vomiting from meningeal irritation. The primary care provider and nurse practitioner may be responsible for follow-up after treatment and report back to the interprofessional team. These patients need close monitoring as they are prone to infections, coagulation dyscrasias, and relapse. Question 54. A client has been diagnosed with disseminated intravascular coagulation, DIC. Which of the following is contraindicated with the client? A. Administering heparin, B. Administering Coumadin, C. Treating the underlying cause, D. Replacing depleted blood products. Correct answer, B. Administering Coumadin. Question 54 Explanation. Disseminated intravascular coagulation, DIC, has not been found to respond to oral anticoagulants such as Coumadin. Warfarin is contraindicated in patients with hemorrhagic tendencies, for example, active GI ulceration, patients bleeding from the GI, respiratory, or GU tract, a cerebral aneurysm, central nervous system, CNS, hemorrhage, dissecting aortic aneurysm, spinal puncture, and other diagnostic or therapeutic procedures with the potential for significant bleeding. Question 55. Which of the following findings is the best indication that fluid replacement for the client with hypovolemic shock is adequate? A. Urine output greater than 30 milliliters per hour. B. Respiratory rate of 21 breaths/minute. C. Diastolic blood pressure greater than 90 millimeters of mercury. D. Systolic blood pressure greater than 110 millimeters of mercury. Correct answer, A. Urine output greater than 30 milliliters per hour. Question 55 Explanation. Urine output provides the most sensitive indication of the client's response to therapy for hypovolemic shock. Urine output should be consistently greater than 30 to 35 milliliters per hour. Renal losses of salt and fluid can lead to hypovolemic shock. The kidneys usually excrete sodium and water in a manner that matches intake. Diuretic therapy and osmotic diuresis from hyperglycemia can lead to excessive renal sodium and volume loss. In addition, there are several tubular and interstitial diseases beyond the scope of this article that cause severe salt-wasting nephropathy. Question 56. Which of the following signs and symptoms would Nurse Maureen include in her teaching plan as an early manifestation of laryngeal cancer? A. Stomatitis, B. Airway obstruction, C. Hoarseness, D. Dysphagia. Question 54. A client has been diagnosed with disseminated intravascular coagulation, DIC. Which of the following is contraindicated with the client? A. Administering heparin, B. Administering Coumadin, C. Treating the underlying cause, D. Replacing depleted blood products. Question 57. A non-immunized child appears at the clinic with a visible rash. Which of the following observations indicates the child may have rubeola, measles? A. Small blue-white spots are visible on the oral mucosa. B. The rash begins on the trunk and spreads outward. C. There is a low-grade fever. D. The lesions have a teardrop on a rose petal appearance. Correct answer, A. Small blue-white spots are visible on the oral mucosa. Question 57 Explanation. Koplik spots are small blue-white spots visible on the oral mucosa and are characteristic of measles infection. Most cases show the characteristic Koplik spots of the disease, located in the buccal mucosa at the height of the second molar, and appear 2 to 3 days before the rash and disappear on the third day. Question 58. A child is seen in the emergency department for scarlet fever. Which of the following descriptions of scarlet fever is not correct? A. Scarlet fever is caused by infection with group A Streptococcus bacteria. B. Strawberry tongue is a characteristic sign. C. Petechiae occur on the soft palate. D. The pharynx is red and swollen. Correct answer, C. Petechiae occur on the soft palate. Question 58. Explanation. Petechiae on the soft palate are characteristic of rubella infection. Postnatal infection with rubella can be asymptomatic in approximately 25% to 50% of the patients, especially in young children. The incubation period ranges from 14 to 21 days and is followed by a prodromal illness characterized by low-grade fever, malaise, anorexia, headaches, sore throat, and adenopathy. Question 59. A child weighing 30 kilograms arrives at the clinic with diffuse itching as the result of an allergic reaction to an insect bite. Diphenhydramine, Benadryl 25 mg 3 times a day is prescribed. The correct pediatric dose is 5 mg/kg/day. Which of the following best describes the prescribed drug dose? A. It is the correct dose. B. The dose is too low. C. The dose is too high. D. The dose should be increased or decreased, depending on the symptoms. Correct answer, B. The dose is too low. Question 59. Explanation. This child weighs 30 kilograms, and the pediatric dose of diphenhydramine is 5 mg/kg/day. 5 by 30 equals 150 per day. Therefore, the correct dose is 150 mg/day. Diphenhydramine, which is available as an over-the-counter medication, is a first-generation antihistamine that is used in a variety of conditions to treat and prevent dystonias, insomnia, pruritus, urticaria, vertigo, and motion sickness. Question 60. The mother of a 2-month-old infant brings the child to the clinic for a well baby check. She is concerned because she feels only one testis in the scrotal sac. Which of the following statements about the undescended testis is the most accurate? A. Normally, the testes are descended by birth. B. The infant will likely require surgical intervention. C. The infant probably has only one testis. D. Normally, the testes descend by 1 year of age. Correct answer, D. Normally, the testes descend by 1 year of age. Question 60. Explanation. Normally, the testes descend by 1 year of age. In young infants, it is common for the testes to retract into the inguinal canal when the environment is cold or the cremasteric reflex is stimulated. About 3% of full-term and 30% of premature male infants are born with one or both testicles undescended. Approximately 80% of cryptorchid testes descend by the 3rd month of life. This makes the true incidence around 1%.